8,000. That is how many people died in long-term care facilities in Michigan through July of last year.
That's according to a new Auditor General report, and it's way more than the 5,600 the state had originally reported.
But this right here, this 8,000 number, is far closer to being accurate than the 5,600 number.
The House Oversight Committee on Thursday picking apart a new Auditor General report that says the Michigan Department of Health and Human Services undercounted deaths in long-term care facilities by almost 40%.
But this is the most accurate count we have as to date.
The findings do note that many of the undercounted deaths were from facilities that weren't even required to report those numbers at all, based on guidance from the federal government.
We determined that MDHHS was not requiring adult foster care facilities with 12 or fewer beds, certain home for the aged facilities, and hospice-only nursing homes to report their information to MDHHS.
The report says 923 deaths came from places that weren't required to report numbers. GOP members of the House Oversight Committee say those were deaths all the same, counted or not.
If you don't count these, what you're saying is, well, that person's life in that facility was somehow less valuable than the life of the facility that was required to self-report. In what world would that make any sense?
To get their data, the Auditor General relied mostly on addresses, matching death certificates from the state database to addresses of long-term care facilities and those other places that weren't required to report.
Again, we wanted to make sure that every single one of our 8,000 had an address or name that matched a long-term care facility.
They said 85% of their addresses matched. The state already used the same information for contact tracing.
We felt that if they could use it for those purposes, that we could also rely on it then for the address information.
Testifying later on before the committee, MDHHS Chair Elizabeth Hertel said the state did what they were supposed to do.
The total differences represented in the Auditor General's report are not due to miscounts or misreporting by the facilities to DHHS, but by changing core definitions of what the state required for reporting. I think it's important to acknowledge that nowhere in the OAG's report did they use the word undercount. Their report found that we posted all data that we received transparently and accurately.
And we did get a full statement from MDHHS on this, quite a lengthy one. You can read that info on our website.